Next up, we'll be hearing from Thomas Seoh and Adriane Berg, who are respectively the president and director of the Catalyst Institute. And they'll be sharing some insights on the Institute's plans and objectives for 2021 and 2022. Thomas and Adriane.
Thank you, Ian. Adriane's going to go first. Adriane, please.
Thank you so much, Ian. First of all, like everybody else here, I'm delighted to be part of all of this and to help you more aware of what the Catalyst Institute is doing. It might be new to you. We are a nonprofit organization with a very specialized mission in the United States to accelerate the translation of advancements in geroscience and, in fact, any science that deals with longevity and better aging into material and sustainable and accessible gains in public health. And we do this in 4 ways. And what I'm going to do is explain this to you and ask you to really listen to how you can be part of any one or all 4 of these different initiatives. And you'll also see why we're so pleased to participate in Longevity.International and with Aging Analytics in general, who have been incredible supporters of us from the beginning. So one of the things that people always ask is, how did this little nonprofit started during COVID get to be known so quickly? And the answer is, we didn't start during COVID. One of our major initiatives is an annual conference. It's called Metabesity. And it really started in 2017 in London. And was the brainchild of somebody you're going to hear from very shortly, which is Dr. Alexander Fleming. And he brought together, perhaps for the first time, really silo-breaking professions to talk about aging, to talk about intervening in aging, and to change the way we think about aging from a scientific point of view, as well as from a cultural point of view. It was very successful. And in 2019, it was repeated in Washington, D.C. By then, there was already talk about having the very first policy on health span in the United States. Unlike England, we don't have a policy on health span. So what happened then during COVID, right before COVID, we didn't know it was going to break, was that the Catalyst Institute, the nonprofit, was born. And I was asked to be the executive director, basically, of an organization that didn't exist yet. And in my usual fashion, I said, sure, why not? Let's just do it. We'll put on a show. And we did. So one of the 4 things that I'd like you to think about that we're doing is our show, which is our annual 4-day event coming up in October. It's called Metabesity 2021. We're already planning for 2022 live in Washington, D.C. And there are a lot of things that you can do. You can simply be a registrant and attend free of charge. What we do is free of charge. We had over 1,000 people last year. We expect to double that, if not more. The other thing that we do in relation to this conference is we have a 4th day, specialized 4th day, which we call the Emerging Company Showcase, where startups, mid-level companies in the field of longevity and successful and healthy aging come and actually present and meet potential investors. So in addition to our 3 days of education, there's a 4th day where we have a very practical day. The other thing I want you to know, and you'll hear about this from Dr. Fleming, is that our event, 3 days, is really a think tank. It's not so much a presentation and talking head, but it's organized around 12 challenges to getting our policy of health span for all in the US. And those challenges really do require solutions. And our panelists, our moderators will all be talking about solutions. So if you have solutions, we want to hear from you. And you can do that very easily at our 2 websites, catalyst.org or metabesity2021.com, all of which are in the chat. And you will see that there's a contact section there. Please contact us. And I also put in all of our social media to follow us there. So one of the ways you can involve with us is our wonderful conference. Second thing we are doing is we're going to Washington. We are not a 401c3, we're a 401c4, we're not a lobbying organization. We educate both sides of the aisle on what is going on. Now, if you take a look at many of the slides you've already seen, you will see that many of our speakers and our supporters are listed there one way or another. We really do have a voice with regard to geroscience, and we're bringing that to Washington. We call it Project Health Span. We're going to hear more about that from Thomas in a few minutes. But what this really is another coalition, including those folks that you're hearing about here today in Longevity International, because they are preparing for us exactly what the UK did. And we're going to show this. And because we are a competitive nature by nature culturally, maybe we'll get a little competition in Washington to realize how important, how much cost in healthcare we're spending unnecessarily, because we do not have a historically national policy on aging and longevity itself. This is also where the issues of for all come in. We have a very diverse population in the US, and many of the people are very underserved. We've been hearing a lot about that politically, and we're here to say that not only equality in healthcare is necessary, but equality in health span is necessary. Because otherwise, many of the different interventions that you just heard from John Adams, from all of you, can be bought, but not by everybody. And that's why part of our mission is increased health span for all. And the third that I want to talk about for a second is we call it Project Endpoints. Now, when I mention this, you may think, oh, this is a small part of what we do. No, it's really the tail that wags the dog here. We have an FDA, we have regulations for our devices, for our pharmaceuticals, for our biomarkers, for everything that all of you that are creating these incredible interventions in aging would like to be part of our public health and covered by insurance, by Medicare, and all the other problems that we have within our healthcare system can be ameliorated if we pay for prevention rather than cure. We don't do that. We are a very cure-focused nation, which is why I sometimes say we are a great place to be sick, but not such a good place to stay well. Now, with Project Endpoints, we would be changing some of those views right at our regulatory base, the FDA and other regulatory agencies as well, so that this could become a real trickle-down affair, where if our regulators are looking at prevention as much as they do cure, so will our medical professionals, so will our medical training, and so even will our population, looking more at prevention than cure. So that's our Project Endpoint. And in any of these things, whether it's our conference, which is the easiest thing to get involved with, simply attend it, support it. And we support you and your events very, very robustly. Project Health Span, where we're going to the government. We would like to hear what you're doing in your locations all over the world, because we do use that as a lever to get attention to what we're talking about. And finally, Project Endpoints. There's a lot of dialogue here that we need to have. Should intervention in aging itself be considered a disease? You all know that that's been one of the things talked about many times. So there are many ways to work with us. I will say that personally, I'm on the United Nations Committee on Aging. And again, we are taking up that same mission to increase health span for all over the world. So we hope that locally in the US will be a beacon for any country, any organization, any county, any town that wants to increase health span for their population. And I'm going to finish with this. We also have a campus. It's an online platform. We are linking to Longevity International. They have done, as you can see, this yeoman's job in bringing together so much information about the longevity situation worldwide. Our bandwidth is not that kind of analysis. So we are thrilled to be part and to link our Catalyst campus. But what we are is an engagement hub. So the campus is based on the 12 challenges that we would like to overcome. And it is situated so that it's encrypted, it's HIPAA compliant, meaning that scientists, policymakers, insurance, financial professions can talk to each other and feel free to do so, like a think tank. We have mastermind groups that are coming up, but most importantly, it's all being structured and facilitated the way futurists work, because we're really not looking to the present only, we're looking to the future. So that is the Catalyst campus, and you can join us. And of course, everything we do is free of charge. And we will be very happy to give you any information that you need to reach out to your constituents to be all part of this. And on a personal note, I'm going to end right now. It's something that's very important to me, but it really has been, in one way or another, mentioned by almost everybody here. Ilya mentioned it, John mentioned it, I'll mention it. So I don't have what was called the genetic lottery. I failed the genetic lottery. I didn't have one relative that lived past the age of 60, and my father died at 42. And when my last relative died at 60 at the funeral, I said, you know, I don't have a lot of years left. And the person next to me said, what do you care? It's not great to grow old anyway. That was supposed to make me feel better. Okay. Years later, I worked with Dr. Butler, who you may know, at the Longevity Center, and I became a fellow, an age boom fellow. And he had written a book. It won the Pulitzer Prize. It was called Why Survive? Being Old in America. And it was why, same thing as the person at the funeral said to me. Ageism, lack of life purpose, of course, comorbidities, the word we now know because of COVID, and general decline. That's what we're really here to stop. This idea that it doesn't pay to grow old, that if you don't win the lottery, you're better off. So I do want to say this. With everything we're doing from a geroscience point of view and changing the face of biological aging, we also will all be working together on the two-way street. That when it feels better to age, we'll get the governments and the people behind us. And when we can live longer, as we are doing now, that will trickle down to make us all feel better about the years ahead. So thank you so much. And I'm going to toss it right over now to Thomas.
Thank you, Adriane. So Aging Analytics Agency, Deep Knowledge Group, and the rest of the consortium, the founding consortium, this launch today of Longevity.International is timely and highly relevant because, as we've heard before, the longevity space has been growing explosively in recent years. I'm actually supposed to present on a panel at the Gerontological Society of America annual meeting this fall on the growing longevity ecosystem and platforms such as Longevity.International and the Catalyst Institute's virtual campus are nodes and means for those of us in the space to keep up with the growing field and to make these connections. So this is wonderful. As Adriane mentioned, our inaugural edition of our flagship Metabisi conference was held in London in October 2017, then in Washington in 2019. Last year, it was virtual because of the pandemic. In these past conferences, we've had prominent geroscientists and medical researchers, members of Congress and the UK Parliament, executives of big pharma and big food, and emerging companies and longevity VCs and other stakeholders presenting in keynotes, panels, discussions, and fireside chats. As Adriane mentioned, for our 2021 edition, this coming October, we're going to do something a little different. We want to workshop specific challenges and solutions that slow or stand in the way of rapid translation of science into public health. So earlier this week, there we go, we issued a press release naming 12 key challenges to increasing healthy longevity. We're not claiming that these are the 12 key challenges, and our list may change over time, but from our lane of accelerating the translation of emerging science into healthy longevity for all, we name a dozen and we group them into 4 themes. The first cluster deals with getting evidence that solutions actually work, that they are effective. Catalyst Executive Chairman Zan Fleming will focus on this cluster, so let me skip these first 3 challenges. The second cluster falls under the category of optimizing public-private policy. Challenge 4 is establishing a national policy for encouraging and achieving healthy longevity. The US, which is in fact one of the leaders in geroscience, is not among the leaders when it comes to making healthy longevity a national priority. This notwithstanding that we are on an unsustainable trajectory of exploding private and public healthcare costs and the accelerating graying of the population. As we mentioned before, in contrast, the UK has adopted a national goal of increasing average health span by 5 years by 2035 with equitable access across society. So setting a national policy would also require the adoption of laws and policies that would facilitate and encourage development of interventions for healthy longevity. Challenge 5 is providing public investment in research and development of healthy longevity solutions. And I can report as part of Project HealthSpan, one rare bipartisan initiative in the current Congress in the US appears to be the creation of a civilian health agency to fund bold initiatives in health. The number of 6.5 billion is currently on the table, dollars, in the style of defense programs such as DARPA and BARDA. Challenge 6 is incentivizing the healthcare system to target healthy longevity in everyday practice. Here, the target is healthcare practitioners and payers who typically are in silos of medical specialties and reimbursement or non-reimbursement. The third cluster is under the category of aligning commercialization and economics. Challenge 7 is enhancing the conditions for private investment, for example, by adopting laws and policies to align incentives for the development of generics for longevity indications. Absent such provisions, no private party would make such investments because the data would benefit free-riding generic competitors who didn't fund such data. Challenge 8 is developing alternatives for marketing healthy longevity products. This is a question of supporting business models, new business models, in contrast to, for example, the classic pharma biotech model of developing novel molecules and charging a premium for that precludes most or many from access. Or on the other end, developing nutritionals that are marketed without reliable data. Challenge 9 is making the economic case to stimulate practical action. The concept of the longevity dividend has been around in this iteration since at least the aughts of this century, but healthy longevity is not yet a US national priority, and funding for research into individual diseases collectively far outweigh the funding for delaying or reversing biological aging, which could eliminate or diminish chronic diseases in one fell swoop. There have been economic analyses, such as expected trillions of dollars in savings for incremental years of extension of healthy longevity. Such analyses must be updated and refined to persuasively account net for entitlement payments and other perceived socioeconomic costs. The fourth cluster falls under the category of addressing human behavior. Challenge 10 is finding effective ways to get people to practice healthy habits. All the funding and laws and policies won't make any difference if the public will not adhere or comply with or practice healthy habits. Why spend the time and resources to develop a pill that mimics the benefits of exercise if the pill taker decides to spend more time on the couch watching TV and eating potato chips? So challenge 11 is figuring out how to reach the disadvantaged. In other words, to ensure that healthy longevity is not just for the well-off. Healthy longevity would actually be one of the few ways to move the needle on health inequities, because it would directly address one of the root causes, i.e. the differential access to medical care and treatments available to the disadvantaged in comparison to those better off. The full public health benefits and economic savings and economic opportunity would only be realized to the extent healthy longevity is accessible to all or most all, not just a subset of the society. Challenge 12 is educating consumers and advisors and policymakers to make evidence-based decisions. This education is both informational and instructional. Informational, for example, because many fear longevity. They envision a drooling, demented nonagenarian in a wheelchair instead of a vibrant, alert, independent elderly who looks and feels and acts like a healthy 50 or 60-year-old today. And instructional, we need to help people think about how to assess claims based on reliable evidence versus hype. So our intention is to start the conversation on these challenges and possible solutions on community boards of the Catalyst Virtual Campus, culminating in white papers proposing tractable steps. And we invite you into the conversation on platforms such as the Catalyst Virtual Campus, the Longevity.International platform, and similar venues.